Here at St. Petersburg College Dental Hygiene Program, we take infection control very seriously. This video will demonstrate the protocol that each dental hygiene student must follow when first entering the clinic to perform dental hygiene treatment. After washing hands and forearms for 2 minutes with soap and water, the clinician will put on their PPE or personal protection equipment. It will consist of a disposable gown, usually blue in color for the student, or lab coat. Then you will put on a face mask. And then you will put on your safety glasses. The next step is to put on examination gloves, which must also be worn for disinfection and cleaning of the dental unit. Make sure the gloves have not been compromised. SBC uses an EPA-approved intermediate-level surface disinfectant to clean and disinfect the dental unit. 2 accepted procedures can be used: a 2-step spray wipe spray and a 1-step pre-soaked wipe. First thing in the morning, the 2-step spray wipe spray will be utilized. The clinician needs to make sure to control and direct aerosol production with a paper towel. First spray, then immediately wipe with the paper towel on the operator's stool and the entire dental chair. Then use the dampened paper towel to wipe down the light handles, the bracket tray area, including the holders and all the knobs. Then wipe down the suction area and the holders. After the wiping is completed, take a new paper towel and lightly spray mist again to disinfect the operator chair, the dental chair, the suction area, and bracket tray to once again control the aerosol production. Do not spray directly into the hand pieces. The unit must be left to dry for 10 minutes. The clinician will also need to bleed the unit water lines. This includes the air water syringe for 2 minutes, and if being utilized, the ultrasonic or piezo unit for 2 minutes. Remove your gloves and wash your hands, and now the clinician can cover parts of the dental unit with disposable plastic barriers. Please note where they are placed. Place the sticky barriers on the operator chair, all adjustment handles, and back of the chair. On both of the light handles and the on-off switch there on the bottom. On both control panels of the unit, on the handle of the bracket tray, on the handle of the mobile cart, and a sticky barrier on the X-ray view box on-off button. Next, disposable plastic sleeves are placed on the suction hoses. First place in the suction tip, then put over the plastic sleeves. Do not use or cover the assistant water air syringe. Next, cover the headrest with the head rest cover. At the bracket tray area, insert the air-water syringe tip. Then place the sleeve over it. Cover the computer mouse with a baggie and put a small white garbage bag on the white hook on the mobile cart. The clinician can now place the instrument cassette on the bracket tray and gather all necessary items for patient care. Remember to provide your patient with a pre-op rinse. You are now ready to seat your patient. After the patient is dismissed, the clinician must wear all the required PPE, including mask, safety glasses, and utility gloves to protect themselves and future patients from disease transmission and ingestion of unwanted aerosols. The use of utility gloves is crucial when handling sharps, instruments, and cassettes to protect the clinician from any injury. With utility gloves on, wipe all debris off instruments with a damp gauze. Any items saturated with blood and/or other potentially infectious material should be discarded in the white trash bag and then placed in the red biohazard bag. All sharps need to be disposed of in the sharps container located in the sterilization room. Close the cassette and return it to the sterilization room window. With disposable or utility gloves on, return to the dental unit and remove all plastic sleeves and sticky barriers. Remove the barriers at the suction area, on the light, the operator stool, and the bracket tray, and place all the used barriers in the headrest cover. And take all the waste to the white trash can. When you're done, then wash, dry, and store your utility gloves in your large plastic storage bag. Between patients, the one-step process of pre-soaked wipes will be utilized to clean and disinfect all components of the dental unit. Usually, 2 wipes are necessary. 1 to thoroughly clean, and then repeat with a second wipe to disinfect. First, wipe the bracket tray area, the keyboard, and top of the mobile cart. Next, do the patient chair, the light handles and switches, the operator stool, and last you'll do the suction area. and any other areas that do not have barriers. We'll then repeat with the second wipe. Between patients and at the end of the day, make sure you clean the entire base of the chair, including wiping down the cords, poles, arms of the unit, and the rheostat. Also between patients and at the end of the day, you will lightly spray a 4x4 gauze with solution from the bottle marked light cleaner to wipe off the actual shield of the light. Spray the 4x4 lightly with the solution and do not spray directly on the light. Use only this solution on the light. At the end of the day, the wipe spray procedure will be done. At the end of the day, the clinician will also clean out the suction trap. See an additional video for this procedure. Also clean the poles, the base, the cart with the duster. In closing, may we suggest you view this video along with the suction trap video often to remind yourself of the clinical protocol for disinfection of the dental unit and protecting yourself and your patients from disease transmission.